Are your prescriptions getting to be too expensive? What are some ways to potentially save money when you're filling your medications? The first one is talk to your doctor. They may have a couple different recommendations to try to get cheaper medications. One, they may look at, instead of a brand name, look at a generic medication. Or they may look at a completely different drug that can still fix the problem, but perhaps is cheaper. They may also recommend, though, Canadian pharmacies or a specific pharmacy for that medication that may be known to be cheaper, such as some blood thinner medications, maybe through a specific pharmacy in Florida, or going to Canada may be cheaper. Another way you could potentially save money is perhaps you're on a name brand medication and there is no generic that would be best, is calling the pharmaceutical company directly, asking about financial aid or what type of aid they have. Even if perhaps you aren't extremely low income or low assets, you may still be able to qualify for discounts or free prescriptions or lower co-pays by calling them directly. Another way is looking at online pharmacies, such as Amazon or Mark Cuban's costplusdrugs.com has a lot of generic medications that may be cheaper. It doesn't necessarily always mean that they're going to use insurance. Again, it's just like using discount programs such as GoodRx, but is very upfront and clear about their costs and what it would cost for those medications. That's another way to potentially save. Now, whether you're on group, individual, or Medicare coverage, all of those previous things I just mentioned could potentially help you save money. But now, specifically if you're on Medicare as well, there's a couple of other things to keep in mind. Is if you are low income and low assets, you could qualify potentially for state aid through state Medicaid program or through federal programs such as Extra Help. Extra Help is designed for those who perhaps don't quite qualify for Medicaid. It's a little bit higher thresholds of assets as well as income that will help reduce your prescription drug costs. And even if you do qualify for state Medicaid, you could still qualify for Extra Help and have both programs to help cover your different premiums and drug costs when you're filling your medications. Nowadays, nothing is super cheap by any means, and medications are becoming very essential in our lifetime, and they can be very costly. So hopefully this information has helped you to be able to be an educated consumer and be able to potentially save money on your prescription drug costs.